that now. So big question, what is pain? How do we define pain? So there's the International Association for Study of Pain, and that defines pain as an unpleasant sensory or emotional experience with actual potential tissue damage. I think it took them a long time to come up with that because it's a very difficult kind of concept to give a definition to. So it's sensory and emotional experience, and that becomes more important a little bit later on. It's very complex and it's very individual. Everybody feels and experiences pain in a very different way. And everyone's going to react very differently. Everyone's got different pain thresholds. The greyhound's going to react very differently to the Jack Russell and all the rest of it. So pain can be mechanical, it can be thermal, or it can be chemical, and most sets of pain will fit within those three definitions. So you'll get a set of responses. So you will withdraw the affected part. So if you touch something that's really hot, you withdraw your arm without knowing it. It's a spinal reflex. And then you get changes in your autonomic nervous system. So your heart rate increases, your blood pressure goes up. Then you get all the steroid hormones being produced, your cortisol, ACTH, and that's all designed to prepare you to have to run from what's ever causing the pain. So definitions. So nociception, so this is different from pain. So this is the neural process for encoding pain. Okay, so this is how your nervous system takes something that's painful and encodes it into a signal that goes up to your brain. A nociceptor, that's going to be the little free nerve endings present throughout your skin, muscles, viscera, joints. Then we can have first pain. So that's that first stab of pain that you feel. If you catch yourself with a needle at work or something, that's that first pain. It then continues to hurt, and that's called second pain, and that's that kind of burning pain you get on afterwards. Analgesia, this is what we're after, a loss of sensitivity to something that would normally be painful. Allodynia, so we'll talk a bit more about this one more in the chronic pain kind of section. So pain caused by stimulus that's not normally painful. So if you were to just go and stroke a patient that's painful, just merely that touch, they react to that as if it's painful when it shouldn't be. And hyperalgesia, which is a exaggerated response to something that, yes, should be painful, but not that painful. If you start to manipulate a joint and the patient kind of freaks out and starts screaming, that's hyperalgesia. And breakthrough pain, I've put transient flare of chronic pain up there, but you can get a breakthrough of acute pain as well. Patients are post-op, you think they're okay, and then all of a sudden they get really painful. That's a little breakthrough pain. Somatic pain, that's pain that comes from your joints, your bones, muscles, that kind of thing. Visceral pain comes from your viscera, and your viscera can only really feel that stretching or distension, inflammation pain if you go and make a sharp cut into the stomach for something. That they don't feel that kind of pain, but they feel that stretching, distension. Neuropathic obviously comes from nerves. Peripheral sensitization, so that's inflammation that changes your chemical environment in your tissue, and that causes your nerve endings, your nociceptors, to become really sensitized to pain. And that moves on to central sensitization, where your brain and your spinal cord start to amplify what messages it's getting from the periphery. So your nerves, they're made up of, they've got the cell body, then they've got a really long nerve fibre, and that can be crazy long. It can go all the way from your fingertips all the way up to your spinal cord, so really long. And they're usually covered in a myelin sheath, most nerves. You do get some that are unmyelinated.